and gentlemen, let me take you back, if I may, into winter of 1999. A young, carefree teenager started to feel unwell. Because being a young person, he ignored his symptoms and he thought everything is fine. But after some time, he decided to see a doctor. When he went to see a local doctor, the doctor said, "You don't need to worry anything. This is just a normal thing. So take it easy. You can go home and relax." But his health started deteriorating with the passage of time. But because his family was going through some financial difficulties, so he did not disturb his family at all. But late March 2000, he was unable to move at home. His family was worried. They rushed him into a government hospital. They took him into the hospital. Doctor, they diagnosed, they assessed him, and they said, "You know what? You are having TB, tuberculosis, and you are absolutely at the last stage. There is nothing we can do at home. So unfortunately, I'm sorry." But the young man, he was committed. He said, "You know what? I will not give up. I will give my life another shot." He knew of a charity, so he contacted the charity, and the charity said, "Yes, we can arrange one-off checkup for you through a private doctor." He went to see the doctor, and the doctor said, It's a truth that you're at the end of your life, but you have a chance." How you have a chance? You have to follow the protocols. Number 2, you have to make sure you change your lifestyle altogether. And number 3, you take the medicine which we recommend you. His life took a turn. He changed his lifestyle completely, and he just did everything he could to make sure he followed all the protocols given by the doctors. And to everybody's surprise, within 6 months, he was fully recovered and he was declared fit. The person in the story is your truly, it's Alias, it's me. I'm the one who fought this battle with all my success. The reason for telling you this story is not to glorify me as a person, but to tell you the harsh reality of developing countries. Sometimes you can be fit or you can be diagnosed at the earliest stage, but unfortunately sometimes you don't have the money, sometimes you don't have the resources, and sometimes you have a rogue medical system which does not diagnose the problem at the beginning. So you're left with no choice but to suffer. I survived, but unfortunately I lost my sister and my beloved father in the hand of TB. Ladies and gentlemen, this particular problem, TB, accounts for 30% deaths in subcontinent, 30% deaths. And among others, diseases like cholera, typhoid, and malaria, people, they are going through some terrible times. Christine, can I just look at the next presentation? Next one, please. Next one. If we have a look in 3 different countries, India, Pakistan, and Bangladesh, roughly more or less 40 to 50% people, they don't have access to basic medical health care. Now that's everybody's right to have access to at least basic medical health care. But unfortunately, if we move on to the next slide, you will see some shocking numbers that India, Pakistan, and Bangladesh, they are spending more money on their defense than their health care. It's a crazy world. Unfortunately, we are living in a crazy world where governments, they are more focused on war and killing people than saving lives, right? We can see UK and US, they're bigger superpowers, they have more money, and they're trying to channel their resources to spend more money on healthcare than on defense. And in the third world, in developing countries, unfortunately, the situation is totally different. You will see some shocking pictures. Christine, if you can move on to the pictures. This is the lady, she is going through the baby birth in England, and these are some ladies in India. They have to walk at least 8 to 9 miles to go to the nearest place where she can give a birth to a baby. If you can move on to the next pictures. This is the dental practice in subcontinent. You can see the shocking state in subcontinent. This is quite terrible. These are quite shocking pictures, and I'm really sorry to share these pictures, but this is harsh reality. This is harsh reality which everybody has to see. Now, what can be done? As it's a complex issue, unfortunately, it can't be addressed by any single individual. There needs to be more educational programs, there need to be more awareness, large and collective efforts where everyone needs to be put to make sure this issue is addressed. Especially the governments, local leaderships and local NGOs, they need to be held accountable. So West can make sure every single penny spent by these NGOs and this leadership goes into right avenues. On my personal front, I'm trying to arrange momentum group in India and Pakistan and Bangladesh where I can mobilize people and tell them to go out and at least educate people that there are some diseases which can be cured and managed very well if you start at the beginning. And the third thing and the last thing, which is my passion, I want to build a TB hospital. I know it's a bigger goal and it's a big thing, but I have some support group, they're working around me. So I'm very confident with my passion, with my drive, and with the help of other people, I will be successful.